Hi, I'm Don McRae. I'm the Chief Operating Officer, Chief Nurse and Chief Midwife for Latrobe Regional Hospital. I'd just like to tell you a little bit about what we can offer you in your graduate program. We have a wide range of services. We do a full breadth of surgical services, medical services. We offer you experience in aged care, mental health, rehabilitation, and also in oncology and dialysis nursing. I can still remember my first day on the wards as a graduate nurse. I was in charge of the ward with 2 student nurses and an enrolled nurse. I can guarantee you that won't happen to you here. We have a full range of clinical teachers that will support you on the ward, plus we have a very strong preceptor program that will help guide you through your early learning and put you on the right path for your beginning of your registered nurse career. I'm very pleased to have you all here today, and I look forward to seeing you around the wards.
Hello, my name's Annette. I'm going to give you a brief overview of our emergency department. We moved to a more modern and spacious area in December 2017. Since then, we've become a very busy department with an increasing patient throughput. We have about 30 patient care areas in the ED. We have an assessment room for behavioural issues, an isolation room with negative airflow capabilities, a forensic assessment room, a single room for immunosuppressed patients or babies requiring individual care. We've got a pediatric procedure room and a fast track area, which is staffed by 3 nurse practitioners, and we have 2 more nurse practitioners in training. We've got a 12-bed short stay area as well. We have 3 resuscitation areas, 1 set up for pediatrics and 2 for adult patients, and we have some wonderful modern and up-to-date equipment, including such things as 5 ventilators, as well as machines to deliver high-flow gas via nasal prongs. We've also got a resuscitator for nursing babies under 10 kilos, which has facilities for ventilation and warming the babies. We've got ultrasound machines, a rapid infuser, our own blood gas machine, and we've also got our own blood fridge in the department, and so on. Alongside the emergency department, we've got a satellite radiology department and a satellite pharmacy department as well. And the radiology department is capable of doing CTs, ultrasounds and x-rays. We've got approximately 130 to 140 nursing staff on our roster, and we have an ED educator providing support 5 days a week, Monday to Friday. Each year we've got 3 to 4 nursing staff doing postgraduate studies, and we're not affiliated with any particular university. As educators, we provide support to those people. At any time we have graduates on placement in ED, plus we have undergraduates and medical staff as well. We also provide a discovery program, which is a year-long program for upskilling nurses, focusing on ventilation, cardiac care and hemodynamic monitoring and so on. Every day in the ED department we have at 2 p.m. we have education for around half an hour, 40 minutes, where we focus on best practice guidelines or case studies and so on. So if you're interested in a fast-paced, challenging and stimulating environment, I suggest you come and work in our emergency department.
Hi, my name's Deb and I'm the clinical educator here at Latrobe Regional Hospital for the operating theatres. I have a passion for perioperative nursing and I have been working here for quite a number of years. We have 4 operating theatres, 2 endoscopy suites and a cardiac cath lab, which is the environment that I'm currently standing in. We cover 13 surgical specialties and the main ones include general surgery, orthopaedics, obstetrics and gynaecology and endoscopy. The education opportunities that we can offer you here at Latrobe Regional Hospital within the operating suites is, number one, is the graduate nurse program. We take on 5 graduate nurses every 4 months to give them exposure to perioperative nursing. We also have a discovery program where we take on 2 RNs for a 12-month placement, learning areas of anaesthetics, post-anaesthetic care unit and scrub scout. We also offer support to nurses who wish to undertake postgraduate studies at various universities. I have a great, enthusiastic, experienced team of clinical nurse specialists that help to reach learning goals within those programs. Perioperative nursing is fast-paced. It's an area of, it's highly technical, and we look for people that can multitask, that have critical thinking skills and are situationally aware, particularly when we have emergencies. The goal of the operating theatres here at Latrobe Regional Hospital is to provide patients with the best care possible pre, intra and post-operatively during their surgical journey. You become their advocate, you develop rapport with the patient, and you become their voice when they cannot speak for themselves. And that is one of the greatest benefits of being a perioperative nurse. We here at Latrobe Regional Hospital have really exciting news coming in the future. We're expanding to 10 operating theatres. That'll be 7 brand new state-of-the-art operating theatres alongside our cardiac cath lab, our 2 endoscopy suites, and included in that is a brand new day procedure unit. So the future's looking bright for perioperative nursing here at Latrobe Regional Hospital, and I hope I get to see you soon.
Hello, I'm Angela Jacob and I'm the General Manager for Planning and Redevelopment at Latrobe Regional Hospital. It's fantastic that you're thinking about applying to become a graduate nurse here at LRH. I'm standing in our brand new atrium that was completed in 2017 as part of our what we call our 2A project that included a beautiful purpose-built and contemporary emergency department, additional inpatient units and a cardiac catheterisation laboratory, which was the first one in Gippsland and means that patients won't have to travel to Melbourne for their care. The exciting thing is that we're now expanding again, and that over the next 4 years, planned to be finished in 2023, will be another expansion which includes operating theatres, a new ICU, more inpatient wards, a medical imaging department and a pathology unit. And then a really fantastic special care nursery, paediatric ward and maternity and women's ward as well. So these services are going to mean fantastic family-friendly and patient-friendly spaces, and spaces that staff can work in that really work for them in terms of efficiency and flow, that feel like a nice place to be and that staff can be proud of. And we'd love to see you here to be a part of that.
Hi, I'm Naomi. I'm one of the clinical midwifery educators on Thompson Ward, which is the women's and children's and birthing unit. We have a few different specialties throughout our unit, midwifery, neonatal care and also pediatrics. So in regards to midwifery, we have 12 antenatal and postnatal beds. In regards to labour suite, we've got 3 beds. Special care nursery currently has 6 beds but has the capacity to go up to 10 in the future, and paediatrics has 10. We have approximately 900 births here at LRH a year, and within our midwifery program within our practice we have a few different areas that you could work in: antenatal clinic, birthing suite, postnatal care, childbirth education and domiciliary care, which is in people's homes. Currently we've got educators covering all the different areas. We've got paediatric educators, midwifery as well as neonatal care. How you can get into those areas, there's a few different ways. You can do a postgrad in midwifery, which we do through Federation Uni. It's a 2-year part-time course. And we also have grads coming into special care nursery and paediatrics for their grad year, doing 4 monthly rotations. If you do apply for those, you get lots of study days. You're very well supported by all the staff on our ward. It's a great job. Please come and work with us.
Hello, my name is Beck. I'm the clinical nurse educator here in Critical Care. We are a 10-bed critical care unit here at LRH, which comprises of 6 ICU-equipped bed spaces and 4 HDU beds within the one department. We also have a separate 4-bed HDU attached to our surgical ward, in which we are able to admit patients who are requiring extra or ongoing monitoring outside of the critical care unit. Patients are a mixture of medical and surgical, with a lot of our admissions coming from both the operating suites and emergency department. Our unit welcomes a wide variety of students from third year nursing, 3-month rotations as part of the LRH graduate nurse program, and our in-house CCU discovery program. We are strongly affiliated with the Deakin University as part of the postgraduate diploma and Masters in Critical Care Nursing Studies. Clinical training and support is a passion of ours. Supernumerary days are available to all new and rotating staff depending on previous skill mix, as well as a multitude of online courses and on-site learning days to choose from, including surgical high dependency, ventilation, ECGs, hemofiltration, as well as annual courses that are regularly on offer. We are excitedly awaiting the arrival of our brand new intensive care unit as part of stage 3 of LRH's redevelopment. This upgrade will consist of a state-of-the-art 16-bed ICU with new upgrades and equipment to follow. Planning has already commenced on the new unit with a completion due by end of 2023. We are a team-orientated unit which prides itself on skill building and critical thinking. Our team of experienced and skillful critical care nurses are always available to welcome new staff and students. We look forward to meeting some of you soon.
Hi everyone, my name is Owen Newman. I'm the Graduate Nurse and Midwifery Program Coordinator at Latrobe Regional Hospital, and I'm going to take you through our different graduate nurse programs we offer at LRH. We have 6 graduate nurse programs at LRH, including our mental health program and an EN graduate program. Latrobe Regional Hospital is the largest hospital in Gippsland. We're continuing to expand as well, as described by Angela earlier. We provide a comprehensive range of services. We're a major teaching hospital. We provide a variety of experiences for our nurse graduates, including specialty areas that aren't offered by a lot of other hospitals. The clinic support is excellent with educator and preceptor support. We provide various study days, 7 for the general collaborative programs, more for our mental health programs. If you're coming from outside the region, we can assist in getting you settled with accommodation. And on completion of our graduate year, we can provide lots of ongoing employment opportunities as well, and postgraduate support if that's an interest. We offer 64 nursing graduate programs in the general and collaborative stream, and various other positions in the mental health stream that Jackie will describe a little bit later. In the general stream, we offer 49 positions. We've got 10 collaborative positions, so 2 collaborative with the Yarraman District Health Service, 3 with Latrobe Community Health Service, 3 with Yallambi Aged Care, and then 2 with the Mental Health Service as well. For our general graduate nurse program, we have 3 different intakes, one at the end of January, one at the start of May, and we've got a new intake mid-September. All positions are 0.8 EFT, so 8 shifts a fortnight. And in the general program, you'll get 3 rotations. So you'll get a subacute rotation, an acute rotation, so that's either medical or surgical, and you'll get a choice of a specialty rotation as well. So we've got 8 different specialty rotations for graduates, including critical care, the emergency department, theatre, our day chemotherapy unit, dialysis, hospital in the home, a pediatric and neonatal rotation, and acute mental health rotation. So there's lots of options. I'll describe the support and study days a little bit later. Orientation includes supernumerary days. It does vary depending on the unit you're rotating through. In the subacute units, you'll get 1 day supernumerary. In the acute units, you'll get 2. And in the specialty rotations, it varies depending on the unit, but you'll get up to 3 weeks in some of the units. Okay, now I'm going to describe some of our collaborative graduate programs that we offer. First up, we've got the Latrobe Regional Hospital and Yarram District Health Service collaboration. So we've got 2 grads who will rotate through Yarram and LRH. So they'll spend 6 months down at Yarram, rotating through various different areas in the more rural, smaller district hospital. And then the other 6 months, the graduate will spend 6 months in our acute medical unit here. Our Latrobe Community Health Service collaboration, we have 3 graduates who rotate through. So 4 months with LCHS, 4 months in our acute surgical unit, and 4 months in our acute medical unit. For those who have a special interest in aged care, we offer a collaborative program with Yalambee Aged Care. We take 3 graduates through this program. So 4-month rotation through Yalambee, 4 months through McAllister, which is our aged psych unit here at LRH, and 4 months on our GEM unit, our Geriatric and Evaluation Management unit. Our last collaborative graduate program is our collaboration between our acute surgical units and acute mental health units. This is a January intake. We have 2 graduates who spend 3 months in each area, rotating a total of 4 times for the 12 months. These graduates will also receive additional mental health study days on top of the 7 they receive for the general program. All our graduates are well supported here at LRH. We all know that you're new and you're probably a little bit anxious when you first start. As mentioned earlier, you'll get your supernumerary time, and that varies depending on which unit you're on. You'll be allocated preceptors on each unit, and their rosters should be closely aligned to yours, so you're regularly in contact with them. You'll also get educators who will come see you on most shifts, and they'll also be responsible for completing your appraisals, so they'll be in close contact with you. And as mentioned earlier, you'll get your study days throughout the year as well. On commencing your graduate year at LRH, we have 3 study days before you hit the floor. So this goes through a lot of mandatory training, but also other things that you'll need, such as admissions, transfer and discharge processes. We place a high emphasis on medication safety. Make sure you're familiar with the IV pumps we use here at LRH. Make sure you follow the correct protocols for blood transfusions. Later in the year, we'll go through a clinical deterioration study day, an IV cannulation study day, and accessing CVAD devices, so your PICs and ports. We'll have a professional matter study day that includes options for postgraduate studies once you complete your graduate year, but also some self-care matters as well, because your graduate year is quite stressful. And your last study day will be a preceptor workshop, so training you up as graduates to be a preceptor for future graduates and students. As I just mentioned, some of the assessments we take you through are accessing your PICs and ports, your IV cannulation. There'll be extra assessments if you're rotating through the mental health areas. And you'll be also expected to complete some online mandatory training through our Reason online system as well.
Hi, I'm Jackie Dieter. I'm the graduate coordinator for the graduate nurse program in mental health. Welcome. Latrobe Regional Hospital Mental Health Graduate Program has 1 intake, and that's in January, and applications are offered around July and August. Rotations offered include the acute inpatient unit on Flynn, the psychogeriatric unit on McAllister, the secure extended care unit, the acute crisis intervention service, which includes emergency, community triage and our CL team, the parent and infant unit at Agnes, our community mental health, our secure extended care, and our child and youth community mental health. Graduates are employed on a 0.8 contract for 24 months and have 4 weeks annual leave that is used during the first 12 months. The program involves support and portfolio work in the first 12 months, and the portfolio gives credits for the university component that is in the second half of the program that all RNs are expected to enrol in. Credits for the university subjects depend on which university they go to and how many points are given. 2 extra units are required after completing their graduate diploma to complete their masters. Each new graduate is allocated a clinical nurse educator and a clinical supervisor, and they're provided with ongoing support and training. A preceptor will be allocated during each rotation and a bed-based clinical nurse educator. Initially, they have a 2-week orientation program and 8 paid study days throughout the year. Once they reach their rotation, they will be supernumerary for the first 3 days. At the end of the program, our grads are recognised for their achievement and are most likely to gain employment with Latrobe Regional Hospital, and there are opportunities for more learning that can include discovery programs and postgraduate studies, and there is opportunities for career development.
All right, how to apply for our graduate program here at LRH in 2021. Our job applications open on the 13th of July in line with the computer match system or the PMCV system, and they'll close on the 5th of August. You'll need to apply separately through the computer match system to put in your preferences, but also apply online to us at lrh.com.au. What we need is an application form, which I'll describe to you in a minute. Ideally a photo, just to put a face to a name. A cover letter that includes the key selection criteria that will be outlined in the job advertisement. A resume, the most up-to-date academic transcript that needs to be certified, and 3 recent clinical appraisals that should be relevant to the stream you're applying for. If you're applying for the mental health stream, then this is outside the computer match process, and this will be slightly different. Okay, here we have a copy of the application form for the graduate program at LRH. Up the top is just your personal details. It's all pretty straightforward. In the middle is just the specifying which graduate program you're applying for, which stream, and then the graduating institution you're coming from, and then the areas you completed your clinical placements on down the bottom. On the back of the application form, we've got space for your referees. This has changed a little bit this year as your referees will be forwarded to the computer match website. Below this is just a checklist for yourselves, just to make sure you've completed everything for your application so nothing gets missed. Just be wary when uploading the documents that some sections only take 1 document at a time. So things like your 3 appraisals, you'll have to upload as 1 document. If you've got any concerns, then the graduate program coordinator's details are down the bottom. So myself and Jackie's details. Okay, our interviews this year will be a little bit different from previous years due to COVID-19. Instead of our face-to-face interviews that we usually conduct, they'll be online interviews. All right, it's looking like our interview process will start early September, and we'll be using an online platform through the computer match website, and this will cover all our interviews through all the streams, including mental health. Questions at this stage, hopefully we're going to try and keep them pretty similar to what we use in previous years. So there'll be a few scenario questions, there'll be reflective questions, and we might see if we can integrate some kind of medication calculation test as well. How do we decide our successful candidates at LRH? Well, it's a complicated process. Basically, we combine all your application letter, your CV, your clinical appraisals, your reference checks, your academic grades, and the interview. And we score each individually, add them all up, and then we rank our candidates from there. And from that goes to the computer match system, and depending on your rankings is how we find out our successful candidates. Okay, and that pretty much wraps up our graduate program information. If you've got any questions or you need to contact us about any further information, here are our contact details.